Hello, how are you today?
Good, thank you.
So, why have you chosen a career in healthcare? What skills and qualities do you possess that will enable you to practice completely in a healthcare environment?
Firstly, thank you for your questions. I am Sandhya Malla. I have completed my Master of Nursing International for University of Olongan and Bachelor of Nursing from Purvanchal University of Nepal. During the study time or also after completion my study, I have done various clinical posting in various sectors, which makes me more capable, and I gain lots of knowledge regarding the nursing care and the medical system that is necessary. Now I decided to pursue my career in the healthcare because I have always been passionate about helping others, support them in the different ways to upgrade their health, and I have deployed my skills in assessing the patient with the various medical issues, and also developed my knowledge to provide the holistic care that focuses on the physical, mental, social, and the psychological health. And also my working experience as a registered nurse back to my country also made me more confident and increased my ability to work with various healthcare staffs in the healthcare setting. And similarly, by working in the Australian healthcare facility, I came up to know about the holistic care, or the various types of the care that is provided to the different types of the patients based on their conditions. And also it helps me to widen my knowledge and upgrade my knowledge, and help me to deliver the compassionate care to the patient suffering from the different illnesses. I think to come up with my experience and my qualifications, my skills and my quality will meet the criteria that you are searching for.
Alright. So, this position requires you to have a high level of verbal and written communication skills. Tell us about a time you cared or worked for someone who wasn't able to understand you. What happened and what was the outcome?
Thank you for your questions. I understand and effective communications plays an instrumental role in the sector of the healthcare. The effective communication is very important between the nurses and the patients to for the positives outcomes during the treatment regimen. And also the effective communications or appropriate communication helps to lower the medical errors, and nursing communications can make positive changes even if there is any problems or any types of queries regarding the treatment sectors. And talking about my experience, while I was working for agency in the home care, there was one client. She was female, 80 years, with the physical disability, but she can't understand the English language. So there was the main problem was the communications problems, which I can't understand her language, and also she can't understand my language. Firstly, I talked with her family members to know about their medical conditions, her likes, dislikes, and her behaviors. And I also learned few words about her language that will make her comfortable and be familiar with me. So I decided to change her daily routines. It means for the positive outcomes, like for betterment of their health. I sketched some pictures of their daily utensils or her materials that she uses in the daily lives, her clothes, like the wheelchair, different things, whatever she wants. And also whenever she asked me for help or she wants something from me, I just saw that pictures at the first initial stage. I saw the pictures, and she said yes, or she bow her head. Then I came to understand that she needs this. Beside this also, I show her, I use my body language, my gesture, my facial expression, which make more clear to understand her about what I want and what she want. This was this activity is gone for about 1 week. After 1 week, there was the positive changes in her behaviors, in her daily activities. Her mobility was increasing. Her family members were also very happy, and even due to my work, I was also very satisfied. I think so, from this in non-verbal communication that I have used or that had applied to that client without the non-English background, I was very successful, and I was very motivated to help that such types of peoples in the upcoming days. And I think from my side, my communication skills will help to contribute positively in your organizations that you are searching for. Thank you.
Can you describe a time when you work collaboratively in a diverse team to achieve a desired outcome?
Thank you for your questions. In the workplace, we have to work with the different types of the peoples from the different background. As Australia is the very multi-dimensional or multicultural country, as we know that, so we made the different types of the peoples from the different backgrounds. Instead of analyzing them, we have to work. We have to daily face to them to learn new things, and to work with them in the daily basis, and we have to respect them also in the workplace culture also. And when I was working as a nurse in one of the hospitals, there was I have to work in the diverse team environment. There was a large team members under which we have to work, we have to perform a task for the better outcome, and that was directly related to the patient cares and our activities also. And at that time there was a very large team. At first it was quite difficult for me because I haven't done work, or I have not previous experience regarding this. And there was a set of goal, and there was a team build up for the positive outcomes of the patient. And on the daily basis, tasks were team oriented, and which needs to be properly coordinated to confirm that every task was completed at the time or not. So at that time I was very responsible person, because the supervisor had hired me to do that work and to take the responsible of the all works, either every works are done properly or not. So at that time there were many new staff member or also, but I didn't distinguish them. I always motivate them to work properly, so that every team members work. It means they feel free to work in the workplace culture also, and for the positive outcome. And our main goal was to reduce the crisis or the issues regarding the patient care. And after the 1 month, we came to know that the result was, there was the positive result. It means there was the decrease in the patient complaints, visitor complaints, and the patient was motivating more. So this was the very positive. And also as I have worked very positively and very confidently in the different cultural background teams, I was renowned at the best staff also, and it was a very good experience to work in the group team member.
Finally, do you have any question for us?
Everything was clear, but I just want to ask about what types of training or educational training do you provided if you hired the newly staff? Thank you for your times, and thank you for your cooperations. Thank you.